Emphysema.
Hey.
Hi.
Hiya.
Hey. Hello.
So, what is emphysema? Emphysema is a pulmonary disease which affects the small air sacs in the lungs, known as alveoli. There are a number of causes of the condition which result in the pathogenesis of the disease, leading to the symptoms observed. However, although there are treatments that can be implemented, there is no known cure.
The primary function of the respiratory system is to oxygenate blood, which will then be delivered to the rest of the body via the cardiovascular system, or to remove certain waste products resulting from internal respiration. During inhalation, air enters the body through the nasal cavity and continues down the trachea, where it divides into two bronchial tubes, which divide further until becoming terminal bronchioles. Within the lungs are small gas exchange units called alveoli, which are found at the end of the terminal bronchioles. They provide a large surface area for the exchange of oxygen and carbon dioxide in the body.
There are a number of known causes of emphysema, all relating to the continued inhalation of airborne toxins. However, the most common cause is smoking, which is responsible for approximately 90% of causes of the condition.
There are numerous pathways by which emphysema develops. Each is a result of constant irritation of the lungs by particulates. The two pathogenic pathways that follow include airway remodeling, where the respiratory tract undergoes changes such as hypertrophy of smooth muscle and mucous cell metaplasia. The second pathway results in the gradual degradation of alveolar surfaces when alveolar macrophages recruit other immune cells to cause elastolysis, which results in emphysema. Emphysema occurs when the alveolar surfaces are damaged, losing elasticity, causing overstretching of the alveolar walls. The individual alveoli then merge with adjacent alveoli, forming larger air spaces, but causing a decrease in surface area and loss of capillary beds, which results in inefficient gas exchange. Emphysema is a condition where a sufferer can experience both baseline symptoms and symptoms of exacerbation, which are experienced after contact with bacteria, viruses, or further pollutants. This is Bob. He's been smoking for 30 years and has presented to his GP with the typical symptoms and signs of emphysema. He is presented with baseline symptoms of breathlessness on exertion, tightness of the chest, and a chronic dry cough. Other baseline symptoms include tiredness and weight loss. Baseline signs include peripheral and/or central cyanosis, which is when the skin becomes blue in colour due to poor oxygenation, and a barrel-shaped chest due to overinflation of the lungs. Symptoms of exacerbation include increased sputum production and a change in colour or consistency of sputum.
There are three main types of treatment available for emphysema sufferers, and although none of them can reverse the damage in the alveoli, the treatments can slow the development. Bronchodilators and inhaled steroids ease shortness of breath and constriction of airways. However, they are known to have limited effects. Antibiotics are also commonly taken simultaneously in order to prevent the occurrence of bacterial infection. There are several types of therapy that can be applied. Pulmonary rehabilitation, also known as breathing exercises, helps the muscles that are involved in respiration to work effectively. To increase blood oxygen levels, supplemental oxygen can be administered directly into the respiratory tract through a narrow tubing via the nasal cavity. There are two types of surgical treatments, the most invasive being a full lung transplant, which is used as a final option if all other treatments have been exhausted. The other is a lung volume reduction surgery, which involves the removal of the most damaged part of the lungs, which will ultimately allow the remaining healthy tissue to function better.
In summary, the main cause of emphysema is tobacco smoking. Emphysema is a progressive disease and involves the destruction of the alveolar surface, causing inefficient gas exchange. The symptoms experienced can be classified as baseline or symptoms of exacerbation. There are three broad treatment options that include medication, therapy, or surgery. There is no cure. However, treatment options are available to improve the sufferer's quality of life.
Created using Powtoon.